I grew up in a small city in Argentina. Almost everyone was extremely Catholic, heterosexual, prone to pursue careers such as doctor, accountant, architect. Me, always the artsy kid, at 13 was certain I liked girls, did not ever believe in religions, lived in a family where I was never asked how I felt. They were not mean people, but had serious issues with communication. I told my mother I wanted to go to therapy. She said she wouldn't pay for it because psychologists always blame the mother. I tried to go to free therapy in a public hospital. That did not work. The psychologist left me waiting for an hour and saw me in a rush because she was dealing with a kid with an addiction crisis. So I didn't feel comfortable nor listened to, and I never came back. For our Latino and Hispanic American viewers, this story may hit particularly close to home. I mean, yes, there are 20 countries in Latin America alone, so there is incredible diversity among the cultures and heritages of these Americans. Heck, long before Columbus sailed the ocean blue, grand and unique civilizations flourished throughout the Americas. But there are a lot of cultural things that many Latino families do share. I'm not just talking about delicious food and incredible art and scientific ingenuity. I'm talking about the deep shared history, particularly in this century, that influences a lot of what it means to be a young Latino in the US today. So in this video, I'll talk about some of those historical relationships, explain some specific concepts that might affect the mental health of Hispanic and Latino youth, and at the end, I'll talk about specific suggestions for communicating and finding treatment. And of course, we'll have a cameo from our guest speaker, Sabrina Vera. Before we dive in any further, I want to give a quick disclaimer about the terminology that will be used in this video. We use the terms Hispanic and Latino or Latino American a lot, and you might have heard them used interchangeably, but there is a difference between them, and some people identify more with one term over the other. In general, the term Hispanic refers to anyone who speaks Spanish or descends from a Spanish-speaking population, while the term Latino refers to people who are from Latin America or have Latin American ancestry. So when we say Latino American, we're referring to people of Latin ancestry living in the United States. This distinction can be especially important if you're from, say, Brazil, where Portuguese is spoken, making you Latino but not Hispanic. Because the term Hispanic is often used by entities like the US Census Bureau, we'll use this term when we're looking at statistics or surveys that specifically specify this demographic. We also want to acknowledge that Latinx has become a popular term in the US to reject the gender assignments of the terms Latina and Latino. Because of our global audience, we use the terms Latino and Latino American to match the vocabulary of Spanish speakers outside of the US. So when we say Latino, we use the term in a gender-neutral sense. That being said, we encourage you to look into using Latinx as part of your own vocabulary. Hello. Welcome to this video. Oh,
this is the intro.
Okay, now let's dive in. At 18.1% of the population, Hispanic Americans make up the largest minority population in the US. In fact, between 2010 and 2019, Latinos accounted for 52% of all US population growth. But despite the important presence of Hispanic Americans, our mental health statistics reflect deep racial inequities. Hispanic youths face rising rates of mental health disorders and are often at greater risk than white children. They also exhibit higher levels of depression than their white and African American peers when responding to discrimination. Latino Americans also have low access to quality mental health care services at large. This comes from a variety of factors: lack of insurance coverage, issues with immigration, as well as language and cultural barriers, which can be particularly difficult for indigenous Latinos who speak languages other than Spanish and Portuguese at home. So as a result, Hispanic Americans with a disorder are unlikely to seek treatment. 20% will talk to their general practitioner about their symptoms, while only 10% will actually meet with a specialist. It's not surprising then that Hispanic youths are half as likely as white youths to use antidepressants or to take stimulants for attention disorders. So there's an issue here. But to come up with ideas for a healthier future, we have to first understand the past. Time for history. Let's start by looking at the history of Latino presence in the US. For starters, many American states were originally Mexican territory until 1848, when Mexico lost the Mexican-American War. This means many Mexican families have been on this land for centuries. And then in the mid-1900s, the Bracero program brought more Mexican workers to the US to cover labor shortages from World War II. They mostly worked short-term contracts in agriculture and were promised benefits and transportation back to Mexico after their contracts ended. But employers enjoyed the cheap labor and exploited many workers without paying them anything at all. This, in part, spurred the Chicano movement of the 1960s, which is sometimes called the Mexican-American Civil Rights Movement. Before then, Mexican Americans were deemed racially inferior and discriminated against, even though they were labeled as white by the US Census. The Chicano movement became a watershed of sorts that saw Mexican Americans, especially young people, openly embracing a non-white identity to pave way for the Latino pride that we know and love today. Other Hispanic Americans have a long and complex history with the US as well. For example, under the Jones-Shafroth Act, Puerto Ricans have been deemed US citizens since 1917, just in time to be drafted into World War I. But now, more than 100 years later, Puerto Ricans still cannot vote in the general election. Then there's the relatively recent migration of refugees from Central and South America. Unlike the many Cubans who fled to the US with political refugee status in 1959, which happened after the communist Castro regime took power in Cuba, Central and South Americans are seldom granted the same refugee status. So these individuals might need more mental health support. I mean, immigration is already really tough. Recent immigrants of all backgrounds have to adapt to a new country and culture and will probably have different issues and stressors than their American-born counterparts. But given the trauma they or their families might have experienced in their home countries and the stress of being denied asylum, many Latino American refugees, particularly from Central and South America, have it especially tough. But what are they fleeing from? Why would you leave your home, family, and everything else you've ever known? To keep a very complex story short, basically the Cold War destabilized a lot of these countries, and Central and South America were particularly impacted during the later half of the 1900s, when many communist and fascist rebel groups and military dictatorships took over. Because of the Cold War, the US and the Soviet Union fought wars by proxy, basically meaning that they used other nations as substitutes for fighting each other directly. Cold War US wanted to prevent any communist power from influencing Latin America, regardless of what the people in those countries actually wanted. And bam, we have our problem. In Guatemala, for example, the democratically elected president was replaced by a US-backed authoritarian regime in 1954. Why? Well, that president's land reforms, which benefited indigenous people, were bad for America's United Fruit Company. And there's more. In El Salvador, the US endorsed violent military governments. In Nicaragua, the US funded the right-wing Contras, a terrorist group. And in Chile, the US backed Operation Condor, a program of right-wing dictators who assassinated anyone who appeared to threaten anti-communist regimes. There's even more history, and I could go on, but that would take a long time. So to summarize as best as I can, the US played a huge role in destabilizing many Latin American nations. But most non-Cubans in the last few decades were denied political refugee status. So even though they might be fleeing to the US, oftentimes just to survive, it is almost impossible for them to become a citizen. It's important to keep this history in mind during today's migrant crisis. Well, what's today's migrant crisis? Let's take a look. Basically, overall, the number of migrants from Latin America has remained roughly the same over the past decade. Mexicans made up a large proportion of this movement for a long time, but the situation changed recently. At the US-Mexican border, the vast majority of the people who are now taken into custody are non-Mexicans. Many of them are from the northern triangle of El Salvador, Guatemala, and Honduras. Families and unaccompanied children represent 65% of that population, and the percentage who are refugees and asylum seekers has increased dramatically as well. Most of these people are fleeing for their lives. And one of the reasons is that the level of violence against women is one of the highest in the world in Central America. It's really frightening stuff, made worse by the misconceptions and downright hateful comments about Latinos thrown around in the US. I mean, take President Trump, for example, who described Mexican migrants as rapists, criminals, and gang members. Or the El Paso shooter, who claimed that there is a Hispanic invasion of Texas. Remember, folks, Texas used to be Mexican territory. So all this hostility culminates with ICE, or the U.S. Immigration and Customs Enforcement Agency. ICE conducts random raids that forcibly removes parents from their children, detaining migrants in detention centers with horrific treatment. No, like, seriously. They've been accused of giving psychotropic drugs to kids as chemical straitjackets. So, understandably, it can be traumatizing to be Hispanic or Latino in the US right now. Even if you're not experiencing all that I just said firsthand, the rhetoric and threat is palpable. So this is terror and pain that no one should have to go through. Given all of this, there are a few steps you can take to keep yourself as safe as possible. If you're taking psychiatric medication, for example, stock up if you can, and carry a copy of the doctor's prescription with you. If you get questioned or detained, you'll at least have these on hand and can prove why they're necessary. But please be careful with this if you or your family members have a history of overdosing or seriously considered overdosing. Your health and safety matters. Another thing you can do is carry a copy of your passport or green card if you have it. A driver's license or student ID works too. Having something is better than nothing if you ever get stopped. Know your rights. So we just summarized the past and present histories, which is a lot of information, but it all matters when we discuss mental health. This is partly because the lived experiences of previous generations can affect you through epigenetics, where things like trauma and physical distress can alter gene expression. And that might affect your own well-being generations down the line. This doesn't mean that you're bound to experience a mental illness, but acknowledging your ancestors' trauma can be a reminder that mental illness isn't your fault. It can also mean that seeking help might be more important for you than for others. But more than that, history also helps explain why different generations have different mental health concerns. Latino Americans, like other racial minorities, are seemingly susceptible to the immigrant health paradox, which basically states that the longer a Latino individual is in the US, the more likely they are to have a mental illness. Which seems like a paradox because you might think that a recent migrant would have poorer health since they have to adapt to a whole new country. But while research on this is limited, it does say that one potential reason is that those who stay here longer have prolonged exposure to new stresses about immigration status, racism, and insurance, for example. Why does this matter? Well, about 2/3 of Latinos today are born in the US, so their needs might be different from that of their parents or grandparents, the first-generation immigrants. So knowing this can be helpful with explaining your concerns to your family or your healthcare provider. What this also highlights is how family and Latino culture at large can play a huge role in mental health. From intergenerational trauma to clashes between immigrants and their children, cultural aspects of the Latino identity matter a lot. One such cultural aspect is, unfortunately, anti-Blackness or colorism. In Latin America, colorism arose during the colonial era. After Spaniards colonized indigenous land in the Americas, a power system was established based on Spanish and European ideals. People with lighter skin were considered superior. And this history has led to discrimination against darker-skinned people in some Latino communities today, which is especially tough for Afro-Latinos who might feel too dark to be Latino, but too Latino to embrace being African. This struggle with identity and self-worth can contribute to mental distress. So it's important to remember that colorism is only a reflection of history, not a value statement on you. Being confused about who you are is nothing to be ashamed of, and it's human to want to explore your sense of self. Seeking help along the way can be a valuable addition to that process. Another aspect of Latino culture is the idea that men should embrace machismo. Men have to be strong or even aggressive to protect their loved ones. There's no room for weakness. Given history, it's not surprising that Latin men have had to be strong to protect their families. But this expectation comes at a cost. In order to prove how macho they are, men might overdrink, overwork, or shrug off health concerns. Because asking for help can be viewed as a sign of weakness. They might delay treatment. While understandable, this can be dangerous, especially over time. But machismo affects Latin women as well. While men are expected to be strong, there's also the idea that women are inferior and in need of protection. Latina feminists often use machismo to explain how women are exposed to street harassment, stalking, and violence. And when harassment is the norm, women might feel like they can't speak up if something happens to them. Or worse, they might blame themselves for what happened. And you can bet that that does not help anyone's mental health. Things might be easier if we can just talk honestly with each other about what's going on. But it's tough to have that conversation when stigma against mental health concerns is very, very real. One study found that even among Mexican medical students, 83% of them connected mental illness to aggression. The stereotypes and fears surrounding mental illness makes it intimidating to seek support, since you don't want others to think badly of you, and admitting mental illness seems like a surefire way to do just that. Even though a mental illness diagnosis does not mean a person is violent, it can be tough to remember that when others around you are constantly saying otherwise. In fact, fewer than 1 in 11 Latinos with a mental disorder seek specialty mental health services. And when you look at the stigma, it's understandable why. There's a popular saying in many Hispanic households, "La ropa sucia se lava en casa," meaning don't air your dirty laundry in public. You don't want to bring shame to you or worse, your entire family. And if you do seek treatment for mental illness, there's the added fear of being dismissed as just local or crazy. So stigma clearly matters, but even more so than you might think. In fact, stigma can even impact how people manifest mental illness symptoms. Like other racial minorities, Latino individuals are more likely than white Americans to experience somatization, or the physical signs of psychological distress. In part, it's our body's way of telling us to please notice or seek help. So if you're not feeling well physically, it can be a sign to check how you're doing mentally. Keep an eye out for any chronic physical symptoms that seem out of the ordinary or unexplainable, and see if you can connect them to your mental health. Another thing to look out for is culture-bound syndrome, which is a disorder that shows up particularly within one culture. One example is mal de ojo, or evil eye, which tends to affect young children and babies. Because there's a supernatural component to it, it's not recognized by Western medicine. But that doesn't make symptoms like fatigue, headaches, or exhaustion any less real. Another example is ataque de nervios. Ataque de nervios is associated with Caribbean Latinos in particular, and often happens as the result of a stressful event. The person experiencing the attack might feel out of control or be screaming uncontrollably, crying, trembling. In some cases, it might even involve seizures or fainting. These might not be what a Western psychiatrist is used to treating, so choosing a provider who understands your culture and needs can play a big role in getting quality treatment that's right for you. But if seeking professional help is too intimidating, which honestly, understandable, you can start by looking for help with the people closest to you. Your family. Latino individuals often have large, close-knit families who can promote resilience to mental illness. Striving to create a better life for yourself or for your family can be both a powerful motivator and protective factor. When things get tough, holding family close can give us hope to keep fighting. And inviting your family into the healing process can make you feel less alone.
Now wait,
you say. Didn't you talk about how stigma is really bad and family members can make us feel guilty for having a mental health condition? Yes, fair point. Opening up to your family about personal struggles can be scary. But more often than not, they're not trying to hurt you. There's just a difficulty in communication. And sometimes parents are too used to the chancla rather than hearing you out. But that doesn't mean that there's no hope. One way you can approach them is by explaining mental illness in a way that's easier for them to understand. You can do this by relating your own syndromes to the culture-bound syndromes that we talked about earlier. This could look like comparing schizophrenia to nervios, which generally holds less stigma. In fact, one study found that Mexican American families were less likely to blame individuals for their mental illness when it was talked about in a way that was culturally meaningful. So, using your culture to explain what you're feeling might help you overcome some of the associated fears in your family. If you experience other physical symptoms that you can connect with your mental health, you can tell your family about those too. While you shouldn't have to physically suffer to get help, explaining your symptoms in this way to your family might help them better understand your circumstances and take you seriously. Even with this strategy in mind, it can be difficult to explain your suffering to parents who have sacrificed a lot to get you to where you are today. This can be especially the case if you have immigrant parents. It's important to remember here that mental illness doesn't discriminate. It can be hereditary, and your parents' experiences don't make your suffering any less legitimate. At the end of the day, sometimes the best thing you can do is just be honest. When talking to immigrant parents, you might say something along these lines. I really don't know why I'm feeling this way, and I feel terrible for being so sad when I know you went through so much worse to get me here. I promise it's not because I don't see all that you've given me. I really am so grateful, and I want to make the best of this life that I can. I want to honor what you've sacrificed and make you proud. That's why I'm asking you to understand that I think I need to seek help. It's not because I think I've experienced all the violence that you have. It's because I've seen how it has affected you, and I want to be able to conquer pain like you have. Still, sometimes the people closest to us are not our family, but our church community. That's a great support factor too. Church communities can be strong protective networks, and having a relationship with God can help you heal during difficult times. Drawing on spirituality or internalizing motivational Bible verses can provide a sense of hope. But some churches do stigmatize folk healing methods. Because of this stigma, people who use these healing methods might not want to tell others about it, especially if they're engaging with a syndrome that has a supernatural component, like mal de ojo. This matters since in some parts of the US, 50 to 75% of Mexican Americans rely on traditional healers. And if stigma is preventing you from being transparent with others about the different medications and herbs you're taking in all forms of healing, there could be dangerous drug interactions that your doctor won't know to warn you about. This isn't to say that you should avoid the church to help overcome the stigma of folk healing, or avoid folk healing to feel more accepted at church. But it's important to be honest about any forms of treatment you use to keep yourself safe. Even though using traditional healing along with Western treatment plans can feel a bit mismatched, when it's done safely, the two can complement each other and help you hold on to your cultural background throughout what can be a scary and lonely healing process. Other resources like meditation, apps, and support groups can also be helpful additions. Online resources are also often multilingual, like these ones here. Point being that it's worth your time to seek community wherever you can, whether that's by attending church gatherings, talking to a counselor, or joining a common interest group online. The key here is to build a support network. Collectivity is strength. No one walks this earth alone. And to drive that message home is my good friend, Sabrina.
Hey everyone, my name is Sabrina Marie Vera, and I am a proud first-generation Boricua woman from Chicago, Illinois. I recently just graduated from Pomona College with my bachelor's in politics, and I'm here today to offer a nice message of solidarity to all those looking into the Letters to Strangers project, specifically looking at mental health within the Latinx community, which is a very broad and complex topic, but I think one thing that we can all agree on is that mental health is heavily stigmatized within a lot of communities of color, and the Latinx community is no exception. At the end of the day, I know that it is up to us to continue to dismantle those stigmas against mental health, to tell our parents or other people in our community that mental health is real, therapy is valid, and medication helps and works. And to anyone suffering from mental health or even physical health, I suffer from a rare blood disease known as HHT. It's heavily influenced my mental health as well. Everything really does have a lot of intersections with each other, whether it's race, ethnicity, physical, or mental health. And it's a lot to deal with, but we are strong. If I had to really drive home one message, it's that we come from a long line of resilient and powerful African and Indigenous ancestors who have pushed and fought for us to be here today. We are our ancestors' wildest dreams. So when it comes to mental health and those moments that you're feeling really down, allow yourself to feel, but also ensure that you can ask for help if you need it, because there is nothing weak about asking for help. It is a sign of strength and resiliency and self-love. Love that you care for yourself, which you should, because you are valid, you are amazing, and you are part of a very beautiful fabric of our future. So that's all I have for now. Take care, stay healthy, practice self-care, and see ya.
Thank you so much. So we've talked about community, family, church, and traditional healing methods. But there comes a time when all that might not be enough on their own. That's when we have to do that thing that you've been avoiding: seeking formal treatment in a Western healthcare setting. I know, it's scary. Accessing treatment can be difficult for a number of reasons. First, there's the associated stigma, but hopefully you can use one of the strategies we talked about earlier to communicate your truth. But what might be an even bigger problem is the American healthcare system itself. It's notoriously difficult to figure out how it even works, but when you add in language and cultural barriers, it gets even more confusing. And frankly, that's not all. The really insidious thing is the historical exploitation that helped grow the system in the first place. Let's see. In the 1930s, the US government funded a program to sterilize Puerto Rican women without any alternative methods of birth control. By 1968, about a third of Puerto Rican women were sterilized. Another example happened in 1964, when the US government intentionally infected more than 5,000 uninformed and unconsenting Guatemalan people with bacteria that cause sexually transmitted diseases. Point being, American healthcare has not exactly had the best interests of Latinos in mind for a large part of its history. So that fear of seeking professional help, very, very valid. But the thing is, seeking help is not just to use the system, it's to help yourself. Avoiding treatment until it's too late can be dangerous, which is why bridging that mistrust can be so important to getting the help that you deserve. Now, one way to build that trust is to look for a culturally competent provider. A provider who is culturally competent understands how your culture and experiences influence your specific needs. When you're looking for a culturally competent provider, here are some questions that you might want to ask them. You can also look up counseling centers online for clues of a culturally competent provider. Check if they offer multilingual services, and if things are urgent, you can even call a Spanish language hotline for immediate help. But at the end of the day, there might be one thing still holding you back, even after you've found a counselor or center that might work for you. Yep, health insurance. In the US, almost 1 in 5 Hispanics are uninsured. This is partly because registering for anything tends to require a social security number, which is something that many asylum seekers and undocumented immigrants don't have. It's also because using government-subsidized Medicare can disqualify immigrants from receiving a green card or permanent resident status. Obviously, these are very real concerns. The good news, though, is that not all centers require you to have a social security number in order to get help. This is the kind of thing you can look for on their website, if you can download their patient registration form or ask to see one in person first before you decide to use their service. And when it comes to costs, a lot of centers offer a pay-as-you-can scale, called a sliding scale. This is something to check for during your search online. You can also use an online lookup tool to help you find a center that fits your needs. If you do have health insurance but just don't know what you can use it for and how much deductibles are, you can usually look up your benefits online to see what's covered and how much you might have to pay. You can also call your insurance company to ask specific questions. So, we've gone through the history, the culture, the community, the help-seeking, the healing, and touched just a bit upon the sheer incredible diversity of Latino and Hispanic Americans. But of course, things are never as easy as a YouTube video can make them sound. So if nothing else, remember to focus on your resilience. Whenever you tap into your personal strengths, make note of that. You're capable of so much, so allow yourself to be wowed, but also allow yourself to be vulnerable. Recognize that your emotions are valid, legitimate, and getting the support that you need is a sign of strength. It's allowing yourself to take care of your own well-being so that you can be that source of support for someone else as well. At the end of the day, you are not fighting this alone. Your life is your own and no one can ever take that away from you. And that's a promise.